Well, good afternoon, everyone. Welcome to another one of the Tennessee Commission on Aging and Disabilities webinar. Today is November the 2nd, 2018. This is kind of our, well, this will be the last webinar before the end of the year, so we decided we would provide an annual data update. And so you can see on the agenda, we're doing the annual part, and then we'll give you a little bit of updates on legislation, and then we'll leave some time for questions. So anyway, we're glad you're on the call, and we will get started. So what we typically do when our commission comes in, which is sort of like our board of directors, is we put together a kind of a list of the programs that we do. And what you see in front of you right now is the federal and state programs that we are required to do, and they're listed by different categories. So you'll see that as we go through the different slides. Nutrition, livability, in-home services, elder rights, healthy aging, and access to services. And again, these are federal and state programs that we are required to do based upon the monies that we receive. So for purposes of nutrition, we do obviously home-delivered meals. We also do congregate meals, which are meals in a kind of a group setting. You usually will find those at senior centers or senior organizations where groups of people come to get meals and eat together. We also do SNAP outreach, which is tied to nutrition. Excuse me. Livability, transportation. Obviously, one of the major things that we're concerned about dealing with older Tennesseans, and we've talked some about that before on previous webinars, the idea of transporting people who may have trouble getting around at this point, and that's taking people to grocery stores or to the doctor's office or to the pharmacy. A very big program. There is transportation provided in Title IIIB that comes from federal monies. It's not a lot, but it is something that we do, and it's something that we worry about. In-home services options, a state-funded program created by the state legislature. And then we also have tied to in-home services, case management, caregiver support, and we also have money tied into that from 3B through the federal government for some in-home services as well. Elder rights, another kind of a, well, federal and state program, I guess, because there's obviously federal money that's coming in, but a lot of state requirements in terms of protecting our aging population. We have a public guardian program, which is a state-funded program. Public guardian deals with folks who are getting older, who at this point in their lives don't really have anybody else left to make decisions for them or take care of them. So that's the public guardian program. We have, I think, currently, they're all across the state. We have 9 regions through our AAADs. So we have 9 local public guardians, and all told, they have about 450 cases that are currently pending with the public guardian program, appointed by the court to take care of people who really have no one else to take care of them in terms of making decisions for them. That's the public guardian program. We have a long-term care ombudsman. I think we've talked about that before. That's an individual who goes into nursing homes and assisted living facilities and provide advocacy services for people in those facilities. We also have a major legal assistance program that also is funded through Title IIIB funds. Healthy aging, senior centers are always tied to healthy aging because a lot of the evidence-based health programs that we put on are done through those senior centers. And the last category, access to services, we call it I&A. It's really information and referral. That's getting people on the phone and giving them information they need, referrals to places where they can get help. SHIP, State Health Insurance Assistance Program, that's helping people understand Medicare and dealing with open enrollment, which is going on right now. And then you've got SNAP outreach again, which is access to services. So in terms of this slide, this is the initiative slide. So the first slide was the things that we have to do. These are programs that are either somewhat tied to what we have to do or things that we have pushed forth kind of on our own to kind of deal with those categories. So food insecurity study under nutrition and the provider phone calls, those are tied to trying to figure out better ways to make sure that seniors are getting meals. So food insecurity is tied to trying to figure out why do we have such a high food insecurity rate in Tennessee? What are the issues? What are the problems? Why can't people get access to food? Is it that they're reluctant to use the system? Do they not know where they are? Are they feeding their grandkids instead of themselves? Are they feeding their pets instead of themselves? So we've done food insecurity studies with the help of Middle Tennessee State. We use that information to better utilize our funding through the senior nutrition program. And we also get on the phone and talk to our providers to find out what they're seeing and what they're doing and what best practices they have. Livability transportation map, we have that online, so if people are looking for services, particularly in terms of public transportation, you can go onto our website, pull up the transportation map, get a county, and it will give you information about what may be available in your area to make sure that you transport the places that you need to go. Now, I will say that this area is still lacking. We have funding going on through the senior grant program that we talked about on the last webinar. That's to build up the senior volunteer base across the state. In the next 3 years, we hope to open up 30 more volunteer senior transportation programs in 30 different counties across the state, which is not going to address the entire state, obviously, because we have 95 counties. But it is going to start finding more places where people can get access to transit and transportation. In-home services, one of the initiatives we're working on is a waitlist prioritization. That's for the options program. We used to say that we had about 10,000 people waiting to get onto our options program. We're now down to around 6,000 or 7,000. That's because we've gone through the list, try to prioritize. We're trying to make it so that people kind of understand where they are on the program and make sure that those folks who are in really desperate need of the program kind of get to the top. That's always been the case. But making sure that people who are just calling saying, I need something in particular, that they understand that they may need to wait until the idea is to make sure that really we spend more time focused on those people who really are in need of services or getting close to in need of services, so we can make sure we prioritize who's getting those services. Elder rights, several initiatives that are up, Bank Safe, dealing with educating the financial institutions, model approaches for senior legal needs, and the CAREVA program. All those are tied to elder rights. CAREVA is one of our newer programs that's tied to actually trying to help people who are victims of elder abuse to get them kind of back on their feet or get them things that they might need due to the abuse. Good programs. These are all new. A lot of those have come as a result of a kind of a renewed focus by the state legislature on increasing criminal penalties for those who take advantage of older Tennesseans, who abuse them, who financially exploit them. Very appreciative of the state legislature over the last couple of years. They have really increased the kind of the impact of the laws so that we are more protective of older Tennesseans. And we keep working on it. I think Tennessee, based on what we hear nationally, is recognized as one of the top states in terms of what we've got on our books and what we're trying to do to make sure that we protect our aging population. Healthy aging, several things that we do, initiatives, Tennessee Senior Brain Games, which is a statewide program, trivia-based, where we have a competition among all the senior centers. And I will tell you that, in case you don't know, Jonesboro won again. They won for the 3rd straight year this year. They were our defending champions. They hosted the Senior Brain Games, and they won by 1 point over Chester County. The rules are that the winning team hosts, but the rules also say that if you won 3 years in a row, we bring it back to Nashville. So we will be hosting the games next year to take away their home court advantage. Other things that we're doing in terms of healthy aging, Tennessee Fall Prevention Coalition, that is obviously programs designed to deal better with helping people prevent falls. The same thing with Cell Grants, which is the next item. Medicare preventative services. There are a number of services tied to Medicare that are preventative in nature, and we try to get that information out. We also work with the leading group in Tennessee dealing with suicide prevention, all geared towards finding ways to improve people's health as they get older. Access to services, we do a number of different things that are tied to giving people information about the programs that are out there. We have a county by county. You can see if you go to our website. We do these webinars. We have benefits outreach, particularly through our SHIP program. We have a speakers bureau. You can always contact us. We'll come anywhere in the state and talk to any groups that you might want, particularly, you know, Kiwanis or Civitan or Rotary or any of those groups. We're happy to come out and talk about these particular programs. We have a community resource guide. Well, most of our AAADs have the community resource guide. We have resources as well. And then we are currently working on a resource mapping program. Most people think of resource mapping as knowing where specific things are. Our resource mapping that the state legislature asked us to do, particularly Senator Rusty Crowe this last year, is to find funding sources in state and federal government and make sure we know where that money is going and make sure we're maximizing the efforts to get that money and make sure it goes out to the people it's supposed to. Advocacy and partnerships, I'll go through this one relatively quickly. These are groups that we work with. Nutrition, we work with a series of groups, our AAADs, which are our area agencies on aging disability, the human resource agencies, and the development districts. Those are those initials. We get together now and talk about how better to deal with senior nutrition, always looking at efficiency, cost effectiveness, and providing good quality meals at the best price we can get so we can do more of them. Livability, number of different programs you can see, volunteer transportation programs. We have an interagency task force on housing and health, which includes a number of state agencies all working towards the same thing, and that is trying to figure out better ways and better programs to deal with affordable senior housing, sorry. But health is involved with it because obviously if you're in a house, usually you have better health results. Tennessee Livability Collaborative, that's a group that we work with I believe, the Department of Health. And then you've got the Senior Trust, Elder Trust grantees, which are all dealing with major issues of livability, everything from senior dental, where they hope to hit about 25,000 people over the next 3 years, a little less than that now. We have legal assistance under that grant. We have senior affordable housing. And we also have senior transportation. Those were the 4. In-home services, Respite Coalition, we do provide caregivers with help through our Respite program. Elder rights, we've talked about some of this already. Again, Senior Trust, Elder Trust grants in terms of providing legal assistance. Advanced Directives Coalition, dealing with advanced directives and living wills. APS, CCR, that's the program that is more designed to just work with people who might need services or help in terms of self-neglect and things like that. And the DOJ Task Force, Department of Justice has been working, the Federal Department of Justice has been working on a variety of different things to try to protect seniors as well. So that's another partnership that we have. Healthy aging, dental health, can't stress that enough. In terms of the fact that in Tennessee, Medicaid does not pick up adult dental, so that's a big concern. We rank, as we probably talked about before, towards the bottom in terms of the states because our dental situation is very poor for adults and for our senior population. And people may go, well, you know, what's the big deal? Problem is, it's a very dangerous situation. It affects people's quality of life. They can't chew. There's a tremendous pain involved with it, and it has serious consequences for other parts of your body. So bad dental can lead to other health ramifications. That's why it's so important. We can't stress that enough. I will also say that if you have bad dental care and you have infections in your mouth, a lot of times you can't get, if you need surgery, you can't get that done until you clean up the infection in your mouth. So it does have serious health ramifications across the spectrum, and that's why it's so important. That's why we spend a lot of time talking about it. Access to services, our AAADs do a great job of providing information and resources, so do other departments. We've got DHS listed up there. So we're always trying to find ways to partner with groups. One of the nice things about this agency and the departments and agencies we work with is that when we need help, they typically come to the table, and we certainly appreciate that. It's a good way of providing information and sharing resources back and forth. Good thing. A couple of different slides just talking about numbers, federal and state programs. Now these are for the state fiscal year 18, which ended on June 30th. These are the overall numbers, just so you get an idea. We were down a little bit on our mills this past year, but the understanding that we're working on getting those numbers back up. So you can see the number of mills and the number of people that were served. Congregate mills, 12,713 people. SNAP outreach, that's that one-on-one screening and application assistance. March through July of 2018, we impacted over 6,000 people. Some of the initiatives just tied to what we talked about before, the food insecurity study we've talked about, monthly nutrition provider phone calls. That's about, again, sharing best practices and getting those numbers up. And just a slide that talks about advocacy partnership, we also talked about that. Those are the partners that we work with on nutrition programs. Livability, transportation, those were one-way rides up there, 239,000, and those are the number of people impacted by it. So we'd love to increase that. That's very important. Again, people trying to be independent, but they may not have access to a car, may not be able to drive, and may not have access to, you know, just basic transportation, buses or whatever. So once you get outside of some of our cities, some people don't have access, and they need help to get there. Initiative, statewide transportation map, that's updated on the TCAT website. And then you've got a grant through the Tennessee Department of Health, that access to health. Through built environment, we are working with the folks in Ridgely, connected to the Ridgely Senior Center. Ridgely is up in Lake County. You should go visit. We are trying to improve the livability and the access to the Senior Center by kind of surveying and understanding what the needs are and what causes those barriers to get around the community. It's a small community. It's a good place to start. Our folks were up there last week and this week talking to the seniors up there. Advocacy and partnerships, you can see there different things that we're working on, volunteer transportation programs. Our staff this year presented at the Aging in America Conference in San Francisco. So we're presenting at national conferences now, which is a big deal. Interagency Task Force on Housing and Health. We meet every other month, and we work with a series of departments. Again, THDA, Tennessee Housing Development Agency, is involved in that. The Livability Collaborative out of the Department of Health, we mentioned that one. And then we work with a number of groups on the Senior Trust, Elder Trust grants. That's the big money that came from the Chancery Court. We're working with Habitat for Humanity out of Memphis, and they've got connections across the state with other habitats. We work with Westminster Home Connection in Nashville, and they've got partners in the northwest corner, and they've got partners in Scott Morgan County. They call it Scott Morgan. It's in those two counties. And then we're working with Southwest Tennessee Development District on the transportation, and we're also working, I think it'll probably show up in a minute, with TALS, which is the Tennessee Association of Legal Services. That's on the legal assistance programs. Here you've got services, state options, 3,184 people served. That was up, I think, at 10%. That's in part, or in probably many ways, connected to extra money that we got from the legislature this past year. That's wonderful. able to serve more people. Caregiver support provided some assistance to almost 1,500 caregivers. That's that respite program. Initiatives, waitlist prioritization, we talked a lot about that, or I did just a few minutes ago. Again, we're still working on that, meetings to try to make sure that we understand how we're going to get that wait list down and how we prioritize those people who come on the program. Again, we've got that sort of in place anyway. We've had it in place, but we're trying to come up with a better process so that people have a better understanding of what they're looking for in terms of the program and what the wait might be. Advocacy and partnership, in terms of caregivers, we work with the Tennessee Respite Coalition. A couple other things, there's the number of people we served on the Public Guardian Program, Long-Term Care Ombudsman. You can see the number of complaints received along with the open and closed cases. The Legal Assistance Program, the number of cases and the hour of casework. There's those programs again I talked about, Bank Safe, Senior Legal Needs, VOCA, REVA. We've got a number of programs floating around to deal with different programs that are up in, just a number of initiatives to help deal with folks who might have been hurt in some way or might be being taken advantage of from a financial exploitation pattern. Advocacy and partnership, those are the groups we work with. There's that TAL, Tennessee Alliance for Legal Services. NPT, they do programs that you can watch online. They do programs, there's a whole series of programs called Aging Matters, and they're working right now on a senior legal program. Here's some other ones. We have 121 senior centers that we work with, evidence-based health promotion programs, so a number of people that we provided programs for, and those are the number of hours for those evidence-based programs. Evidence-based simply means that they are proven, and based upon the funding requirements out of the federal government, we have to do evidence-based programs. So instead of spending money on things that haven't been tested, we spend money on things that have been tested. Initiatives, there's the Jonesboro team, the Old Towners, went for the third straight year. Senior Center Conference, there was a conference held May 22nd, 23rd, where our senior centers came in to talk about different programs and get ideas about things they wanted to do. There's the fall prevention. We received a Cell grant, $148,000 over 3 years. Advocacy and partnership, those are all the different groups that we work with or presentations that we made in terms of things dealing with healthy aging. And now services, information referral, INA gets lots of calls, about 84,000, staff outreach. We have 8 AAADs that have implemented that program, so we have them going on pretty much across the state. There's our SHIP program. We're awfully proud of that one. 115,808 client contacts. It's a lot of people that are being reached out through different events to get information to them or help them one-on-one in terms of things that they need regarding their Medicare. Very important program. Those are some of the initiatives, State of Aging County by County, our aging webinars, benefits outreach, and the list goes on and on. Legislative updates, and I'm trying to go quick because I think I'm running out of time. This is just to update basically on what is going on the federal level. We had told you before that we had received extra funding, which was very, very helpful in the fiscal year 2018 appropriations, which was approved in March. And that money stayed consistent, so the appropriations for this coming year, fiscal year 2019, those programs, we didn't lose any of that funding. It stayed level. And in fact, we got a little bit more money in terms of $5 million for congregate, $5 million for home delivered, but that's nationwide. So we have to split it with the other 50 states. We would really like to have it on our own, but we will share as we're supposed to. State legislation, 1777 by Senator Rusty Crowe and Representative Dale Carr. Resource mapping, we talked about that before. That's mapping funding sources. It's trying to find out if we're hitting all the funding sources that are out there, where's the money coming from, where does it eventually go, and are we efficiently using it all, and are we getting it all? And we're starting to work on that. So the bill passed this year. We have had our initial first meetings, and we have now started mapping, and we'll see, I think our first report is due soon, but that's just the preliminary report. The big report will be next December when we have a chance to go through it and see what we've got. The next bill, palliative care, that has started. We had our first meeting at St. Jude's. Dr. Mohana Karlakar is the chair of that group, and we have started talking about barriers to palliative care, so keep an eye on that one. And I think the last one that we're going to talk about is this one. Senate Bill 1904, House Bill 1899, prohibits the discrimination of an employer against a qualified individual based on disability. We were assigned the responsibility to study that by the General Assembly this year, and we have a report due on November 15th. We have got the draft done. We are getting it checked, and we will have it into the legislature by the 15th. This bill, again, did not pass. There were issues about it, and we were asked by the General Assembly to study it, and that's what we've done, and we will turn in a report very soon. And I believe that's it. Any questions for people? No questions? I think we have like maybe 2 minutes left. I will say that we are getting a question, 1 minute. So this one says, will you provide a link for the NPT dental movie? And we really didn't talk much about it, but there is a dental, that Senior Matters program, we talked about the legal assistance. There is one for senior dental as well. It just came out. It's been on television. Yes, we will. We'll send out a link to it with the answers to the questions. Any questions that we got, we'll send out a link as well. And I think we're going to put a link up on our website as well. And I believe, I know we're getting one more. Okay. So, no, actually, this is just, will we email the slides and answers any questions? Yeah, we'll get them out. Yeah, we'll send all that stuff out as we normally do. We'll send that out next week. Anyway, I think we're out of time. We appreciate people listening. I hope this has been helpful. We've done it this year to try to keep information flowing between different parties. If you have issues, concerns, if you have ideas for us, if you'll let us know, we would appreciate it. We hope this is helpful. If you have other things you want us to talk about, or if you want us to change it up, or you want us to change the picture of me at the beginning of the slide that has been there all year, we'll do any of that stuff. We want to hear your concerns and comments. Let us know. And again, this will be it for this year. We'll be back next year. Hope everyone has good holidays and a good end of the year, and we'll talk to you again next year.